Oh my goodness. Hello. Hello, everyone. I'm back. It's been more than a few weeks since I've come on live, and I thought today I was feeling good enough to come say hello. Most of you know that I had the abdominal surgery, and I was going in for one simple hernia. It was an old one I had repaired, and it needed attention again. It was just not right. When I got into the surgery, they found 3 hernias and that my abdominal wall was torn, just kind of shredded and thinning with more hernias ready to come out. So they had to close those up, stitch everything together. Long story. But with that said, that meant the recovery was a bit more intense and longer than expected. I am still recovering. I'm still in recovery mode, but I'm getting better and better every day. Today I woke up and I was like, wow, I am less sore than yesterday, so this is a good thing. What I did want to come on and share with you is throughout the whole experience, the anticipation before, the waiting, and the recovery during, and then what I'm going to do after. As far as scarring goes, I had the laparoscopy, and it was robotic surgery. Hi, Essie. Oh my goodness. So I have 3 incisions, and the one on the top was a bit bigger, so I'm doing something to take care of that. So I'm going to get right to it. Before the surgery, oh gosh, the anxiety, the jitters, it was out of control. Lots of praying, lots of oiling. My 3 go-to oils, and I didn't take it out. Frankincense, Vitality, a drop under my tongue when I had those moments of all of a sudden it hit me, like I was just like, oh my gosh. So a drop of frankincense Vitality under my tongue. It doesn't taste the greatest, but boy, does it bang out the those jitters I was getting. Or I would put a drop of frankincense in my hands, breathe it in, or I would do that same thing with Stress Away because I just love the smell of Stress Away. And then for that added kick of courage and calming at the same time, I would use Valor, drop in my hands, I'd put it on my wrist, over my heart. And that would get me through the days along with my prayer. Also building up, my mind was going crazy. It was thinking all different scenarios, all different things that could happen. And crazy. I don't have to go into that with you. I think that maybe many of us will understand that the mind can sometimes get out of control. And that's specifically what the frankincense, breathing it in, helped me through. I was also concerned about, oh my gosh, if I get a cold, if I get a cough, if I get this and that, then they're going to postpone the surgery and I'm going to have to go through all of these nerves and jitters again. So I tried to keep my immune system really amped up, and generally it is amped up because I take Ningxia Red every day, I take Sulfurzyme every day, I take Master Formula every day. If I feel still like a little something, occasionally, very rarely, a little something, I'll add a drop of Thieves and several drops of orange oil to my shot of Ningxia Red, and done, I'm fine. So I took Ningxia Red. I usually take 2 ounces a day, but building up to the surgery, I took 4 ounces a day, which is 2 packets. I just wanted to keep myself really well. I wanted no excuses. And to be honest with you, one of the thoughts that went through my head is like, oh my gosh, what if my surgeon gets sick? Oh, I wish he took Ningxia, but that was just one of the funny thoughts that I had. Crazy. I can't believe how the mind just gets out of control. So now, after the surgery, in recovery, the anesthesia had me so nauseous, so nauseous. And they were doing everything for me medicinally so I wouldn't let my insides out. Not that in itself would be a bad thing to relieve yourself, but because I had such intense abdominal work, my pain levels were something that pain medication wasn't even helping. I don't know if this is going to be a weird view, but like right here below my sternum, all the way down to about 1 inch below my belly button and out to the sides is where all the stitching and the work was done to pull everything back into place. And I had polyester mesh put in there. So I'm still feeling stitches and tweaks and pulls, but because of all that abdominal work, sneezing, coughing, laughing, crying, hurling, not a good idea. So the nurses were wonderful. They did everything for me, and most of you know that I'm not anti-modern medicine. I take the best of both of these worlds and work them together. So thankfully I had my oils with me that day. as well. And what I was doing, I asked the doctors, because they're not knowledgeable in the oils and herbals and stuff. I said, can I please just smell my peppermint oil, because that really helps me. And I would smell it and smell it and smell it until I felt fine. So combined effort, modern and oils, it really, really helped me get through that. So I was on, they sent me home with a very limited, the Tylenol. Take Tylenol. It wasn't doing anything. I was like, I'm not taking this. This is ridiculous. So with surgery, I've had 3 C-sections and a prior hernia repair. I know that my bowels get stopped up. So I had to do everything I could. And the gas pressure from this particular kind of surgery was so intense, because they fill your body up with C2, I think it is. And you're just like a balloon for days. Thankfully, my longtime dear friend, Linda Scherter, she's an amazing licensed massage therapist, reflexologist. I mean, she does raindrop massages. She's amazing. She came over and worked on my feet and my legs, where the points are, to help with bowel function and gas release. So we got really close and personal there. She helped me with that, used specific oils on me. Some of the oils, after she left it, I continued to use on myself for all of those gas discomforts, were Digize, and I put a roller top on it, and I would roll it on my belly. I would put it on my feet, massage my heels in those specific areas to help. And something that really, really helped, that my friend Tina had experience with using, that helped her, was a drop of peppermint in your water. Mind you, this is not the Peppermint Vitality bottle. The Vitality bottle is the white label that gives you ingestion instructions. That's my disclaimer there. So a drop of Peppermint Vitality in my water, and I was sipping on it slowly, not using a straw, because that lets more gas in. That's the last thing I wanted. So that helped me cope and get through. Being female, guess what was right on the heels of this surgery? I got my period. Hello, TMI. And I'm like, really? Now I have lower stomach cramps and abdominal this and that. So I didn't want to get near the scars. I have 3 scars, I still had the steri strips at the time on this side of my body. I'm like, how's the Panaway going to work with the stomach, the discomfort you get from your period? All right, well, I guess I'll just apply it to the other side and around and not get... Do you know that it worked? The Panaway worked, even though I couldn't really go near the other side, the left side of my body. It worked. So thank God for that. I continued with my Progessence Plus. Thank God for that. Okay, so now here we are, aftercare. I'm moving around better. I'm almost done here. I don't want to keep you too long. I totally respect your time. But I made a scar care recipe. I did some research in my reference books and online and asking friends, and I came up with this 15 milliliter recipe for scar care. Now, I don't know if some of you remember, I had this big, 2018, what's up with 2018? Big, golf ball size sebaceous cyst that I've been battling for 15 years. It got really bad. It had to be surgically removed, in-office procedure, this one was. But it needed packing. It was pretty intense. The scarring was really bad because of the depth of it. So afterwards, that surgeon said, go to town, use your oils, do what you gotta do. So I'm like, great, I'm going to town. I used this, and I don't think I could show you here. I wonder if I'll get a good angle here. I don't even know if that's working right now. But this, I used obsessively. I kept it on the kitchen counter. I work from home. I know, Essie, what is going on? 2018 was crazy. So I used this recipe, and I had raised skin, and it was just not good. This, amazing, but you have to use your oils faithfully. You can't expect something to work if you're not using it or not using it right. So I plan on using this recipe on those 3 scars. It's got 5 drops helichrysum, 3 lavender, 4 lemongrass, 2 patchouli, 2.5 of myrrh. So I just took a little toothpick and, just cut that drop in half, put it in there, and filled it with V6, because the carrier oil V6 from Young Living has some great qualities to it for skin health. So that's why I chose V6 over coconut oil or olive oil for these particular issues. So 2018, when January came around, I was like, I don't make New Year's resolutions. I just kind of set like these goals for the year. Like, I want to be better, I want to be stronger, I want to be braver. And one of the things with 2018 was I really got to stop putting off some of these health things, because I was always kids first, kids first, kids first, but I was kind of falling apart. So 2018 was the year of I was afraid and I did it anyway. So I took care of the neck, I took care of the stomach, and on a fun note, I actually went to convention, which was a big deal for me. I don't even drive out of my town without getting lost. It's like in my own town, I get lost. It's the craziest thing. But anyway, so that's my surgery story with a little extra added info in there. Thank you, Essie, for being here. Colette, I see you just popped on. Hi, Colette. I'm going to post this so you can watch it in a replay, because I got some good information on pre and post surgery care that hopefully will help. And if anyone has any questions, I didn't get too detailed. I do love to remain FDA compliant. I do my best with that. So please feel free to contact me if you have any personal questions. I am an open book. I am glad to share my story if it helps. Have a great day, everyone. Essie, thanks for being here. Colette, I'll talk to you soon. Bye.